I think that we have huge workforce challenges. I think that's the predominant issue. I think that as we enter into new payment models, because the Sustainable Growth Rate Fix and the Affordable Care Act both have sort of set a stage for alternative payment models in oncology. So we see them in many different ways. There's the MIPS program and the patient quality reporting system, the value-based modifier, the Oncology care model, which is a CMMI Medicare pilot program, the Oncology medical home. And these are all just public. There are so many private models too for alternative payment. So as we go into the alternative payment model, one thing that we'll need, which we've not delivered before, is data. We need to be able to report what we're doing, to report back how we're doing with these alternative payment models, both in terms of quality of care and just outcomes. So to look at how many patients receive care at the end of life, how many patients receive guideline-based care, what is the overall survival of your patient population, what is the total cost of care. Those are all really important questions, and we're going to be asked more and more to be able to answer those questions, which requires data and data infrastructure. What that means is, from the physician side, we have to sort of note more so that people are able to report more. And so that needs to be part of our process workflow in our typical operations in our clinical day. And that's a challenge. So we'll be asked to do a little bit more for each patient. And then, as I mentioned, with the age distribution changes, increasing survival, and the chronic nature of cancer treatment, we are going to be asked to see more patients. And so how do you balance those things without more oncologists? It's a challenge, and I think that different groups are addressing it differently. I think that, moving towards a team-based approach to care to make sure that you can see and take care of all of your patients and be involved in all of your management decisions, but still be able to manage that volume is going to be critical. And I think that, practices that do that well will be able to sustain the change that the future will bring to them.